about what you're experiencing. Things at work are different. You are having to practice in innovative ways, in different types of ways. What's going on at home? Socially, what's going on? You're not able to meet with your friends, and then some of our rituals are being disrupted. Funeral rituals here in the South include viewings and hugging and lots of food, and we can't do that. And then what else is going on emotionally with you? How are you dealing with all of these stressors that are going on? I want you to understand that these reactions are normal, and to tell yourself that they are normal. We have some evidence from past events that helps us figure out what things that you might expect during times of stress and trauma, even though we've never really seen it on this scale as of yet. There are some initial studies coming out of China with the COVID-19 patients. There's high degrees of psychological distress, depression, anxiety. And the interesting thing about that is that in the nurses, in the frontline people, those numbers are even higher. We know from the SARS epidemic that we looked at the impact on hospital workers, and shortly after it, 10% of them or so developed signs of PTSD. And up to 3 years later, even 40% were continuing to experience signs of that. So these are the 4 domains that you might take a look at as far as what reactions you may be having and to think about it. The confusion that I mentioned earlier, the cognitive functionings, the sort of feelings that you're moving through cotton, behavioral issues, risk-taking behaviors, doing things that you normally wouldn't do, not using your PPE when you should. The bigger thing, though, is to watch for an increase in substance use, drinking, alcohol, and that. On the emotional end of it, it's really difficult when you're being hit from all of these different realms to maintain a balance. And that is something to pay attention to and to try to figure out, how do I get that back in the best way that I can? Physical things are tension, feeling muscle aches and pains, the inability to relax. And I know from previous disasters that I've been involved with, insomnia and sleeping tends to be a really huge issue. So take a look at those types of things. This little chart is put out by SAMHSA, and I really like it in that I'm a very visual person. And we're looking at where are we as a nation, where are we as nurses right now? And you may be at different points in this because of where you are physically located and the types of precautions that are being taken. The pre-disaster phase, we're past. We know that that was coming. We know that this is characterized by fear and uncertainty. This is when all the toilet paper disappeared off of the shelves. The impact phase is the heroic phase. It's range of emotion, of intense emotional reactions. I'm going to fix it. I'm going to fix it. I'm ready. I'm getting ready to deal with what's going on. And most of us are probably very close to, if not past that phase as well. The honeymoon phase deals with a high level of activity, but there is a low level of productivity involved with it. So some of us are in this. In fact, many of us are in this. And we're going to begin to fall into this disillusionment phase. And it's going to have a lot of ups and downs. It's going to be when our resources are not there that we expect to be there. And it will continue on for quite a while. We're likely to see a dip during the anniversary time. There are different trigger events that may happen for you. But I want you to pay attention to the other side of this chart, the reconstruction phase, the recovery phase. What we know from the literature is that oftentimes people's resiliency is better than what it was prior to the beginning of the disaster, which is really good news.